Welcome to the Explainer. Today we're diving into something that a lot of cat owners face, feline diabetes. We're going to break down the signs, what's happening inside your cat, and most importantly, how you can manage it. Because with the right care, your furry friend can live a long, happy, totally normal life.
So, let's just jump right in with a question that might sound familiar. Have you found yourself refilling the water bowl way more often lately? Or maybe your cat is suddenly acting like they're starving, just ravenous all the time, but they're still losing weight? These aren't just funny little habits. They could be really important clues.
Right, so these are what we call the telltale signs. They're these subtle little changes that could really mean something more is going on. Let's break down exactly what you should be looking for.
Okay, so the classic signs. First up, a crazy amount of thirst and a lot more trips to the litter box. That's their body literally trying to flush out all this extra sugar. And then there's that huge appetite, but they're still getting thinner. It's so confusing, right? Well, it's because their body just can't use the energy from the food they're eating. It's like their cells are starving, which leads to them being tired, weak, and even their coat looking kind of rough. And listen, catching this stuff early is absolutely crucial. So, what is going on inside your cat's body to cause all this? Well, think of it like this. It's a problem with the locked cells. Let's dig into what's happening. The official name is diabetes mellitus. And really all it means is that your cat's body is having a tough time managing its blood sugar levels, glucose. And this all boils down to a problem with the super important hormone called insulin. Okay, I love this analogy because it makes it so clear. Just think of insulin as a key. In a healthy cat, insulin unlocks the body's cells, right? It lets all that sugar from their food get inside and be used for energy. But in a diabetic cat, there's a problem. Either there aren't enough keys or the locks on the cells are kind of busted. And what happens then? The sugar gets locked out. It can't get in to power the body, so it just builds up in the blood, and that's where the problems start.
Now, hearing that diagnosis can feel like a lot. I get it. But the really good news is that this is so manageable. It all comes down to what we call the management trinity. 3 main things that build a new, healthy routine. And here they are: diet, insulin, and monitoring. That's it. None is more important than the other. They all work together. When you get these 3 things in sync, you can really get this under control and give your cat an amazing quality of life.
First up, diet, and this is a huge one. We're talking about switching to a low-carb, high-protein food. It makes a massive difference in keeping their blood sugar stable. And consistency, it's everything. Same food, same amount, same time, every single day. And here's a super important tip. Always feed them right before their insulin shot. That way, the insulin has some sugar to work with. And that leads us right into pillar number 2, insulin. Since their body isn't doing the job, you're going to step in and provide it. For most cats, this means 2 little injections under the skin every day, about 12 hours apart. You're basically giving them the key their cells need. Okay, let's talk about mastering home care. I know, the idea of testing blood and giving shots can sound intimidating, but I promise you, these things that seem so scary at first, they really do just become part of your daily routine. Checking your cat's blood sugar at home is, seriously, the best way to know what's going on. And it's easier than it sounds. First, you just get all your stuff together. A little tip, warming up their ear a bit makes the blood flow easier. Then it's just a tiny prick on the very edge of their ear. They barely feel it there. Touch the strip to that tiny drop of blood, and boom, you've got a number. Just jot it down, and then, this is the most important part, give them a ton of praise and a safe treat. Giving the shot is just as simple, really. You'll gently roll the bottle, never shake it, then draw up the right dose. You see that loose skin they have around their shoulder blades? That's the perfect spot. You just make a little tent with the skin, pop the tiny needle in, push the plunger, and that's it. You're done. And of course, lots of praise and cuddles right after. And this really is the secret sauce right here. You want to turn these little medical moments into positive moments. If you connect the tests and shots with love, attention, and those special treats, it just becomes normal. It's not a scary thing. It's just another part of the day.
Okay, we have to talk about something really important now, a safety alert. We're working so hard to bring their blood sugar down, right? But sometimes it can actually drop too low. This is called hypoglycemia, and you need to know that this is a real emergency.
So it's super important to get this straight. Hyperglycemia, that's high blood sugar. That's the long-term thing you're treating. But hypoglycemia, that's low blood sugar. That's a sudden, right-now emergency. It can happen if they get a little too much insulin or maybe skip a meal. And the signs of low blood sugar are totally different. They happen fast, and they're scary. We're talking about sudden, major weakness. They might be stumbling around like they're drunk. You could see twitching or even seizures. Any really strange behavior. Basically, their brain isn't getting the sugar it needs to function, and it's screaming for help.
If you see any of those signs, you need to act immediately. Don't try to make them eat or drink. Just get some corn syrup or honey and rub it right on their gums. Their body can absorb the sugar straight from there. And then, call your vet. Do it right away. This is a true emergency.
Okay, after that serious topic, let's circle back to a much more hopeful place. Because a diagnosis is not an ending, not by a long shot. It's really just the start of a new, happy life together.
And this really is the most important thing to remember. Your cat isn't a diabetic cat. They're just your cat. And with this new routine, with the diet, the insulin, the monitoring, they are going to live a long, playful, wonderful life. All the purrs, all the cuddles, all the headbutts, none of that changes.
Look, this whole thing is a journey, right? And every journey starts with just one step. So what's your first step going to be today? Is it making that call to the vet because some of those signs sounded familiar? Or is it just taking a deep breath before you do that first glucose test? Whatever it is, you've got this. Your best friend is counting on you. Thanks so much for joining us on The Explainer.